Well, before we get into some of those stories, let's look at this one. The Minister of Social Development held a media briefing this morning on government's response to the adjusted level 4 restrictions. Let's get the latest from our reporter, Aviwe Mdila. Aviwe, a good morning to you. What have we heard so far?
Morning, Naledi. Yes, the Minister just wrapped up that briefing, ironing out the plans from the Social Development Ministry in tackling some of the issues as they navigate through the level 4 adjusted level in terms of the restrictions. Of course, we heard how even the payouts, SASSA payouts, will be staggered starting from Tuesday, the 6th of July. But just joining me now is the Minister. Minister, thank you for joining us at eNCA. But even those SASSA grant payouts, the queues, given that this Delta is really ravaging through South Africa, aren't those queues even hotspots themselves for the COVID-19 variant, and how we navigate through that?
Thank you, Aviwe, for the opportunity. Yes, we continue to work very closely with the provincial governments, with the local structures to make sure that the queues are reduced as much as possible. Recall that even the issue of staggering of the payments, it came through for the first time due to our experience of COVID-19. Hence our call also to our communities, our recipients in particular, that they don't really necessarily have to go exactly on the day that the money gets in there, but we are also conscious of the fact that they are hungry, they need the money. So from a SASSA perspective, we are making sure that the offices at a local level, those offices must try and make sure that they maintain the queues properly. And it is for this reason also that we had volunteers that were under the National Development Agency to be able to go out there and help. And I know it's very difficult because even everybody is afraid of going out there. So we still continue to call on our people to try the best that they can, that they themselves must also take responsibility, and ours is to be there to assist them to make sure that the queues are not too close, people are not close to each other. They must wear their mask, they must keep their distance, and they must also sanitize.
Minister, I want to move on to the 350 Rand social relief of distress grant. There have been numerous calls for those monies to come back and be paid to those that are unemployed. Will you see a possibility of that happen? And just how much of money are still outstanding?
Well, let me just start from the point that even at the time towards the end of the grant, as a department together with SASSA, we took responsibility of engaging with Treasury to see if they can be able to extend, because we understood the impact of a 350 grant to our people, some of whom I was very excited to hear that some people even started small business or informal business with the money. We are still in engagement with Treasury. Yes, of course, we are conscious of the fact that the purse is really, really squeezed because there is so much demand, including the demand for the buying of the vaccines themselves. We are still hoping that maybe in the continued discussion, we might get a positive response from the Minister of Finance as well as Treasury. But we did make a request because we felt that the impact of the 350, as we did our own research as a department, as well as other organizations that did the research, they clearly indicated how much this money was useful for people, because majority of the people use the money for just buying food, which means that they use the money, take the money back into the economy by procuring their basic needs, which is basically food necessities.
Just quickly, Minister, how much is still outstanding for those that haven't been paid in the previous tenure? And just on the corruption side of things, those have received money fraudulently, even working for government. What's being done about those?
Well, it's very unfortunate, obviously, that we have over 700 million that still is outstanding to be paid to our people. And this is due in many instances to the fact that we had to keep on verifying whether people are really were compliant in terms of their applications, and whether really people were out of jobs, and therefore using the system of checking whether the people deserve to get the money or not was a bit of a tedious situation, but a necessary one. As you rightfully say, Aviwe, there are people who applied, and shamefully people who applied, you even have people who applied from prison, which is a big problem. You even have people who applied who were civil servants. And we have taken this very seriously. We have processed everything from our side as the Department of Social Development and SASSA. The action needs to be taken by the employers where people are in government in particular.
Okay, thank you very much. That's the Social Development Minister, Lindiwe Zulu, just painting out some of the interventions as the Development Ministry just goes into those level 4 adjustments.
Yeah. Aviwe, thank you for that update. Unfortunately, many South Africans right now struggling to put food on the table and many really wanting that grant to come back. That is our reporter, Aviwe Mtila.
With over 13,000 new coronavirus cases being reported in Gauteng alone, the acting health minister has confirmed that it's the Delta variant, originally found in India, that's dominant in that province. The Delta virus spreads faster than previous variants of the virus, which means it could become the dominant one across the country.
The new, now good evidence that Delta is more transmissible than previously circulating viruses and other variants of concern, and that the Delta variant is quickly becoming the dominant variant in the country. You'd remember when we spoke, there was still data that was pending in relation to Gauteng. We can confirm that data has shown that Delta variant is also dominating in Gauteng. However, it is important to just remind the public that Beta variant is still prevalent as well.
But there is a silver lining. Both the Pfizer and Johnson & Johnson vaccines are effective against the Delta variant. Speaking at the Department of Health's media briefing, Professor Glenda Gray, the COVID-19 Research Committee chairperson, also said efforts are continuing to procure more vaccines.
So what we have seen and what results will be coming out is that the in vitro work, the J&J vaccine works better against Delta and gets better over time with both Delta and Beta variants of concern. So this is very important.